Fiona Bruce.
I speak to new clause 31 in my name, which would reduce the upper gestational limit for abortion in most cases to 22 weeks gestation. This time limit amendment would replace the current 24-week time limit for abortions on the ground where there's a greater risk of injury to the physical or mental health of a pregnant woman or any of her children under Section 11A of the Abortion Act of proceeding with the pregnancy. Mr Deputy Speaker, the current 24-week limit law is based on an outdated understanding of the viability of premature babies and needs to be updated.
Is it not absurd that in one ward of a hospital, doctors are fighting to save the life of a 22-week gestation baby, but arguably, on the face of our law, a 24-week baby can be aborted? That is ridiculous. And whatever your views on abortion, this is now the time to review this law, which was dated on outdated technology and medicine practice.
The honourable member makes exactly the right point. Our law needs to be updated. The current 24-week limit was set over 30 years ago in 1990. That legislation removed the previous time limit of 28 weeks. In 1990, 24 weeks was considered the point of viability outside the womb. But scientific advances since those 31 years have been enormous. Latest guidance from the British Association of Perinatal Medicine establishes 22 weeks gestation to be the point of viability and enables doctors to intervene to save premature babies from 22 weeks. A study from a neonatal intensive care unit in London found that survival rates for babies born at 22 and 23 weeks gestation went from 0 in the period from 1981 to 85 to 19% in 1986 to 1990 and up to 54% in the years 96 to 2000, and will no doubt have increased substantially again since then, were figures available. Just these past few weeks, we've seen the incredible story from the American state of Alabama of the birth of a baby boy just 21 weeks old, weighing 14.8 ounces. Curtis Means. He needs oxygen support and a feeding tube, but he is in good health. New Clause 31 is a probing amendment, so I won't be calling it to a vote on this occasion, but I would welcome the Minister's views and look forward to a greater debate on this issue going forward. And may I just use a few moments further to draw attention to and support New Clause 51 in the name of the Honourable Member for Upper Barn, which would clarify that abortion on the grounds of the sex of a fetus is illegal. This relates to the truly awful exploitative practice whereby women can be pressurised into abortions based on the sex of their unborn child. And may I also support New Clause 52, also in the Honourable Member's name, which would seek to bring parity to the law in terms of equalising time limits on abortions which take place on the grounds of disability, so that that would be with the limit on most other abortions. The current law permits abortion up to birth if a baby is deemed to be born seriously handicapped, and this is interpreted to include entirely non-fatal disabilities such as Down syndrome and easily surgically rectifiable conditions such as cleft palate and clubfoot. Clubfoot is something that one of my sons was born with, and I know how rectifiable it is. The law then, in closing, is plainly inconsistent with disability discrimination legislation for afterbirth and sends a dreadful message to people living and thriving with disabilities about how little their lives are valued under abortion law. Again, I look forward to hearing the Minister's views.